Welcome back to Top Doctors, Stories Behind the Summit, the interview series leading up to the Global Summit London, June 26 to 28, 2026. I'm your host, Anna, and today I'm joined by one of the most influential educators and innovators in modern dentistry, Dr. Fay Goldstep is a clinician, researcher, international speaker, and consultant to multiple dental companies. She maintains a private practice in Toronto and is a fellow of the American College of Dentists, the International Academy of Dental Facial Aesthetics, the American Society for Dental Aesthetics, and the Academy of Dentistry International. She has contributed to 4 textbooks, published more than 100 scientific articles, and served on the editorial boards of Oral Health Magazine, Dental Tribune, and Dental Asia. She has taught in postgraduate aesthetic dentistry programs as UNY Buffalo, the University of Florida, the University of Minnesota, and UMKC, and she has lectured on stages from the EDA to EECD, EGD, and major conferences worldwide. Her work has shaped how we understand proactive, minimally invasive, and healing-focused dentistry, and it continues to influence practitioners across the globe. Dr. Goldstep, it's an honor to have you with us today.
Thank you for having me. I'm really excited about the conference, and I'm sure that I'll be learning a lot, as well as hopefully giving people some information that they can take home and work and use in their practices.
I think we can all learn from each other, as there's going to be a lot of international speakers. And I'm also super excited about meeting all of them and seeing all of the perspectives from all corners. Let's jump into the interview. So your your career spans clinical practice and research and education and global lecturing. You're advocating for proactive intervention long before it became mainstream. What originally drew you to this philosophy, and what continues to drive your work today?
Actually, proactive intervention is a term that I actually coined because I wasn't happy with the terms of minimal invasive. Minimal invasive means you're just going to remove less material, you're going to cause less damage, you're not going to invade the body as much as you would normally do under different circumstances. Minimal intervention means you're going to be sitting around twiddling your thumbs, waiting for things to happen and not actually do anything. But if you think proactively, you think of what's going on, what's happening, you are able to understand the system, you understand the science, because science research is really the cornerstone, the keystone of the dental practice. And then you understand what's going on and you proactively intervene when things are necessary. Only when they're necessary, but you know what's going on, you can predict it. Predictability is really important. And now with AI, we're going to have a lot more things predictable because we have a lot of data. So proactive intervention is definitely the way to go in the AI environment.
Right, it's a beautiful concept. And what started this, or what implemented this thought in your head in the very beginning?
Well, when I first saw minimal intervention and minimal invasive, I got, I said, this is not the way I want to practice. I just want to know what's going on. I want to understand the process. I want to know when the best time to actually intervene is. If you say minimal or intervention or minimal invasive, you're thinking minimal, but not exactly when or how or understanding the process. You're just doing as little as possible. Is that good? Is that bad? Less can be more, but on the other hand, sometimes less is not good. Sometimes it's better to do things the right way. So you have to understand the science, you have to understand the research, you have to understand what's happening with your patient and look at the whole system, especially the oral systemic link, which is something that I'm very involved in as well. Things related to oral systemic, and I call it local systemic because the oral cavity is where things start. But the inflammatory burden that goes on in the inflammation that goes on in the oral cavity can definitely impact every other organ system in the body. So it starts there. When do you intervene? Obviously, you try to get rid of periodontal disease as soon as possible and not allow it to go further. So if you have to just know when to act and how much to act, and that's proactive intervention.
Got it. So I would say that not minimal, not too much, but precisely as much as needed, right?
Correct. And it's more predictable that way. And now that we have the data through things like AI, it's much easier to do that. When I first started, I've been in practice more than 40 years. So it's been a long process and I've seen a lot of development. AI is fascinating. AI is something of the future. It's really something that excites me. And I think it's something that is definitely needed in dentistry. And that's where we're going.
For sure. And where do you see the biggest opportunities and in era of AI or limitations?
Well, and biggest opportunities would be in diagnosis because of data. The more data you have, I have 40 years or 40 years plus of experience. When I first started, I had zero experience, so I didn't have that data to fall back on. Now I'm going to have thousands and thousands of other dentists and millions of many, many. I don't want to go with a number, but many, many other practices, many other situations that happened, and the data is all there, and it's at my beck and call. Isn't that exciting? So I'll be able to detect and diagnose things much more easily because I've got other people sitting on my shoulder and showing me the way.
Sure. So we used to rely only on the data that we had in our heads, and now we can reach out to all the data that like from all the heads in the world, right? It's actually a good
Exactly.
slogan.
Exactly. So I have the ability to be part of that big community of dentists and researchers and clinicians from years and years at the same time that I'm doing it right now, and also past people in the past. So it's incredible what's available right now.
For sure. So, well, great clinicians like you and great researchers like you contribute to what AI can use in their systems, right? It's amazing, and thank you for that from the bottom of my heart that we can use your knowledge as well. How do you think we should prepare ourselves in order to successfully adopt all of these innovations?
Well, we have to be careful where we're getting the stuff from. You can't just grab anything off the shelf. You have to research it yourself. You have to be somebody who's discerning, somebody who understands. That's why you have to have the background as well. So you need to learn what is needed and understand the process and do a little bit of the research on your own. And then you can trust. Trust is the absolute, I mean, your data can be right or wrong. And if you're getting the data from the wrong sources, then everything's going to go wrong. So you have to go to trusted sources.
For sure. And then where, if you can maybe suggest from your experience, where shall we start our journeys with our journey with AI?
Well, I would go with researchers and with clinicians that we trust, and then find out from them where they're getting their information. And some of them may not be ready for AI, which is possible, because not everybody is on the AI bandwagon yet. It's going to take a while until. And I've not been on it like forever either. It's taken me a while because I'm not the first. I'm not an early adopter. So I can tell you, I personally am not an early adopter. But once I see the benefit, and I've been to many conferences in the last little while that have shown me the way. So go to AI conferences like the one that we're going to have in London. Go and seek out people that you trust and people that will guide you into where to get that information.
Yes, definitely. So at the Global Summit, you'll be one of the speakers. You'll be speaking to dentists and physicians, scientists, and industry leaders from around the world. And what do you hope that attendees will take away from your session?
Well, I think the best and the most important thing is now we're finally, as I said, oral systemic is something that's coming. The physicians and the dentists are now coordinating treatment for patients. And the fact that we're going to have physicians and dentists together, this is absolutely amazing because that's what happens. It's a total health for the patient. Years ago, when many years ago, dentists did study with physicians and they developed that relationship early on. Then we separated the head from the body, maybe not just the mouth from the body, actually. And all of a sudden, we became dentists and more, not so much the medical physicians of the oral cavity, but more engineers, technicians. And now I think we're integrating that back. So it's becoming a more comprehensive total health idea. That's where we're at. And that's what I hope I will impart to the group, and I hope I will get that from other people in the group as well.
Yes, and I am very curious, where is this all gonna bring us in the future? There's probably gonna be even more fields of dentistry and due to all the developments, right?
Yes, it is going to be amazing, and we have to embrace it, but be critical as well. You can't just embrace everything. I think in the past, people just would jump in. You can't, as it said, because I'm not an early adopter, I try to see all sides, and when I think it's ready, and if I'm ready for AI, it's time.
For sure. Well, Dr. Gossa, thank you for sharing your insights and your deep commitment to elevating the patient-centered and minimally invasive care. And your work has shaped dentistry now. So thank you so much for the interview today as well. And we can't wait to hear more from you live at the Global Summit in London, June 26th to 28th, 2026. And you can all register now at the globalsummit.amors.it, link in the description. So until next time, I'm Anna, and this was Top Doctor Stories Behind the Summit. Thank you so much, Doctor. It was a pleasure.
Thank you. It was a pleasure for me as well. Thank you.
Thank you.